Welcome to the Healthy Pantry, your daily dose of nutritional knowledge and wellness inspiration. We are delighted to have you here. In today's video, we're diving deep into the magnificent world of vitamin D, an essential nutrient that plays a crucial role in maintaining our overall health and well-being. Vitamin D, often referred to as the sunshine vitamin, is unique because our bodies can produce it when our skin is exposed to sunlight. However, despite its importance, many people around the world are deficient in this vital nutrient. So, what exactly is vitamin D, and why is it so important? Vitamin D is a fat-soluble vitamin that acts more like a hormone in the body, influencing a wide range of functions. One of its primary roles is to regulate the absorption of calcium and phosphorus, minerals that are essential for maintaining strong and healthy bones. Without enough vitamin D, our bodies cannot effectively absorb these minerals, leading to weakened bones and an increased risk of fractures and bone disorders. But that's not all. Vitamin D also plays a crucial role in supporting our immune system, helping to defend against infections and illnesses. It's involved in cell growth, inflammation regulation, and even mood regulation, with studies suggesting a link between vitamin D deficiency and mood disorders like depression and anxiety. So, how can you tell if you're deficient in vitamin D? Stay tuned as we explore the common signs and symptoms to watch out for. Remember, maintaining optimal levels of this vital nutrient is key to supporting your overall health and well-being. Let's dive into the signs of vitamin D deficiency and how you can ensure you're getting enough of this essential nutrient. First and foremost, fatigue is one of the common signs associated with vitamin D deficiency. When our bodies lack sufficient vitamin D, it can impact various physiological processes, leading to feelings of tiredness and exhaustion. Vitamin D is involved in the regulation of muscle function. Deficiency in vitamin D can lead to muscle weakness, making everyday activities feel more challenging and exhausting. As mentioned earlier, vitamin D deficiency can result in weakened bones. This can cause discomfort and pain, particularly in the bones and joints, contributing to overall feelings of fatigue. Some studies suggest a link between vitamin D deficiency and sleep disturbances. Insufficient vitamin D levels may interfere with the body's circadian rhythm, leading to difficulty falling asleep or staying asleep throughout the night. Vitamin D plays a role in energy metabolism at the cellular level. When levels are low, it can affect the body's ability to produce energy efficiently, resulting in feelings of lethargy and fatigue. A weakened immune system due to vitamin D deficiency can make individuals more susceptible to infections and illnesses, leading to increased fatigue as the body works to fight off pathogens. It's essential to recognize that while fatigue can be a symptom of vitamin D deficiency, it can also be caused by various other factors such as poor sleep habits, stress, underlying health conditions, or inadequate nutrition. Therefore, if you're experiencing persistent fatigue, it's important to consult with a healthcare professional to determine the underlying cause and appropriate treatment. What's more, bone and muscle pain are significant symptoms associated with vitamin D deficiency, primarily due to the role of vitamin D in calcium absorption and bone health. Severe vitamin D deficiency can lead to conditions like osteomalacia in adults and rickets in children. In osteomalacia, bones become soft and weak, causing dull, aching bone pain, especially in the hips, lower back, pelvis, and legs. Rickets, which primarily affects children, can cause skeletal deformities and bone pain due to inadequate mineralization of bones. Vitamin D deficiency can lead to muscle weakness and pain. This occurs because vitamin D receptors are present in muscle tissue, and adequate vitamin D levels are necessary for proper muscle function. When vitamin D levels are low, muscle strength can decrease, leading to muscle pain and fatigue, particularly in the thighs, shoulders, and lower back. Some studies suggest that low vitamin D levels may be associated with chronic pain conditions such as fibromyalgia and chronic low back pain. While the exact mechanisms are not fully understood, it's hypothesized that vitamin D deficiency may contribute to increased sensitivity to pain and inflammation. Vitamin D plays a crucial role in maintaining bone density and strength. Deficiency weakens bones, making them more susceptible to fractures, especially in weight-bearing bones like the hips, spine, and wrists. Fractures can cause significant pain and impair mobility, further exacerbating muscle discomfort. Severe vitamin D deficiency can lead to a condition known as myopathy, characterized by muscle weakness, pain, and inflammation. Myopathy can affect both skeletal and smooth muscles, leading to symptoms such as muscle cramps, stiffness, and difficulty performing daily activities. Additionally, bone fractures are a significant concern associated with vitamin D deficiency, particularly in individuals with weakened bones due to inadequate calcium absorption. Vitamin D plays a crucial role in regulating calcium and phosphorus absorption in the intestine, which are essential minerals for bone health. Without sufficient vitamin D, the body cannot effectively absorb calcium, leading to decreased bone mineralization and bone density. This weakening of the bones makes them more susceptible to fractures, even with minimal trauma or stress. Chronic vitamin D deficiency can contribute to the development of osteoporosis, a condition characterized by low bone mass and deterioration of bone tissue. Osteoporotic bones are fragile and prone to fractures, particularly in the spine, hips, and wrists. Fractures associated with osteoporosis can occur spontaneously or from minor falls, leading to significant pain, disability, and loss of independence. Vitamin D deficiency not only weakens bones but also affects muscle function and balance, increasing the risk of falls and subsequent fractures, especially in older adults. Muscle weakness and impaired coordination associated with vitamin D deficiency can compromise stability and increase the likelihood of accidents. In addition to increasing fracture risk, vitamin D deficiency may also impair the healing process of existing fractures. Adequate vitamin D levels are necessary for optimal bone remodeling and repair. Deficiency can prolong the healing time of fractures, leading to prolonged pain and disability. Chronic vitamin D deficiency can lead to secondary hyperparathyroidism, a condition characterized by elevated levels of parathyroid hormone (PTH). PTH acts to maintain calcium levels in the blood by mobilizing calcium from the bones. Elevated PTH levels can contribute to bone loss and weaken bone structure, further increasing the risk of fractures. If you find this video helpful and informative, please support the Healthy Pantry channel by leaving your comment below, liking this video, and subscribing for more daily health and nutrition tips. Did you know that mood changes, particularly symptoms of depression and anxiety, have been associated with vitamin D deficiency? Vitamin D receptors are found throughout the brain, including areas involved in mood regulation. Adequate vitamin D levels are believed to play a role in neurotransmitter synthesis and function, including serotonin, a neurotransmitter associated with mood regulation. Low levels of serotonin are linked to depressive symptoms, and vitamin D deficiency may contribute to alterations in serotonin levels. Seasonal affective disorder is a type of depression that occurs during specific seasons, typically in the fall and winter when daylight hours are shorter. Reduced sunlight exposure during these months can lead to vitamin D deficiency, which is hypothesized to contribute to the development of SAD. Light therapy, which mimics natural sunlight, is a common treatment for SAD, suggesting a link between sunlight exposure, vitamin D levels, and mood regulation. Vitamin D has anti-inflammatory properties, and inflammation has been implicated in the pathophysiology of mood disorders such as depression. Vitamin D deficiency may contribute to increased inflammation in the body, potentially exacerbating mood disturbances. Vitamin D plays a role in the regulation of various hormones, including cortisol, the primary stress hormone. Chronic stress and elevated cortisol levels are associated with mood disorders such as anxiety and depression. Vitamin D deficiency may disrupt hormonal balance, contributing to mood dysregulation. Adequate vitamin D levels are important for cognitive function and mental clarity. Vitamin D receptors are present in brain regions involved in cognitive processing and memory. Deficiency may impair cognitive function, contributing to mood disturbances and feelings of lethargy or apathy. Vitamin D deficiency has been linked to sleep disturbances, including difficulty falling asleep and poor sleep quality. Sleep disturbances can negatively impact mood, contributing to feelings of irritability, anxiety, and depression. It's important to note that while there is evidence suggesting a link between vitamin D deficiency and mood disorders, further research is needed to fully understand the mechanisms underlying this relationship. If you're experiencing persistent mood changes or symptoms of depression and anxiety, it's essential to consult with a healthcare professional for proper evaluation and management. But wait, there is more. Vitamin D plays a role in modulating the inflammatory response, which is crucial for the initial stages of wound healing. Inadequate vitamin D levels may impair the body's ability to mount an appropriate inflammatory response, leading to delayed wound healing. Vitamin D is involved in regulating the growth and differentiation of various cell types, including immune cells and skin cells. During wound healing, cells must proliferate and differentiate to repair damaged tissue. Vitamin D deficiency may hinder this process, leading to slower wound closure and tissue regeneration. Adequate vitamin D levels are necessary for angiogenesis, the formation of new blood vessels that supply oxygen and nutrients to the wound site. Insufficient vitamin D may impair angiogenesis, resulting in reduced blood flow to the wound and delayed healing. Collagen is a structural protein that provides strength and support to the skin and other connective tissues. Vitamin D plays a role in collagen synthesis, and deficiency may compromise the quality of collagen produced, affecting the integrity of the healing tissue. Vitamin D is essential for maintaining a balanced immune response, which is critical for combating infections and facilitating wound healing. Deficiency can weaken the immune system, making individuals more susceptible to infections that can impede the healing process. In individuals with chronic wounds, such as diabetic ulcers or pressure sores, vitamin D deficiency may exacerbate existing healing challenges. Chronic wounds are often associated with impaired circulation, compromised immune function, and inflammation, all of which can be affected by vitamin D status. Vitamin D deficiency may influence the formation and remodeling of scar tissue during wound healing. Abnormal collagen deposition and remodeling processes due to vitamin D deficiency may result in hypertrophic or keloid scarring, which can further delay healing and affect tissue function. Moreover, hair loss, also known as alopecia, can be associated with vitamin D deficiency, although the exact mechanisms are not fully understood. Vitamin D receptors are present in hair follicles, indicating a potential role for vitamin D in regulating hair growth cycles. Adequate vitamin D levels may be necessary for maintaining the health and function of hair follicles, promoting normal hair growth and retention. Vitamin D has anti-inflammatory properties and plays a role in modulating the immune system. Chronic inflammation and autoimmune conditions, such as alopecia areata, can contribute to hair loss. Vitamin D deficiency may exacerbate inflammation and immune dysfunction, potentially worsening hair loss in individuals with these conditions. Hormonal imbalances have been implicated in various forms of hair loss, including androgenetic alopecia, male or female pattern baldness. Vitamin D is involved in the regulation of hormones such as testosterone, which can affect hair follicle function. Vitamin D deficiency may disrupt hormonal balance, contributing to hair thinning and loss. Chronic stress can contribute to hair loss by disrupting the hair growth cycle and triggering a condition known as telogen effluvium, characterized by excessive shedding of hair. Vitamin D deficiency may exacerbate the effects of stress on the body, potentially worsening hair loss in susceptible individuals. Vitamin D deficiency can affect nutrient absorption and utilization in the body. Hair follicles require a variety of nutrients for healthy growth, including vitamins, minerals, and amino acids. Inadequate vitamin D levels may impair nutrient delivery to the hair follicles, leading to weakened hair shafts and increased susceptibility to breakage and loss. And lastly, frequent illness, particularly recurrent infections, has been associated with vitamin D deficiency. Vitamin D plays a crucial role in modulating the immune response, including both innate and adaptive immune functions. Adequate vitamin D levels are necessary for the proper functioning of various immune cells, such as macrophages, T cells, and B cells, which are involved in recognizing and fighting off pathogens. Vitamin D has been shown to exhibit antimicrobial properties against a wide range of pathogens, including bacteria, viruses, and fungi. It can enhance the production of antimicrobial peptides, such as cathelicidin and defensins, which help to protect against microbial invasion and infection. Several studies have suggested a link between vitamin D deficiency and increased risk of respiratory infections, such as the common cold, influenza, and pneumonia. Vitamin D may help reduce the risk and severity of respiratory infections by enhancing immune function, reducing inflammation in the respiratory tract, and promoting the production of antimicrobial peptides. Vitamin D deficiency has been implicated in the development and progression of autoimmune disorders, where the immune system mistakenly attacks healthy tissues. Individuals with autoimmune conditions may be more susceptible to infections due to immune dysregulation. Optimizing vitamin D levels may help support immune function and reduce the risk of infections in these individuals. Vitamin D deficiency is more common during the winter months when sunlight exposure is limited. Seasonal variations in vitamin D levels may contribute to the seasonal patterns observed in certain infectious diseases, such as influenza. In conclusion, recognizing the signs of vitamin D deficiency is crucial for maintaining optimal health and well-being. From fatigue and bone pain to mood changes and impaired wound healing, the effects of inadequate vitamin D levels can impact various aspects of our health. By understanding these signs and symptoms, you can take proactive steps to address potential deficiencies and support your body's overall function. Whether through sensible sun exposure, dietary changes, or supplementation under the guidance of a healthcare professional, ensuring adequate vitamin D levels is essential for promoting a healthy immune system, strong bones, and a balanced mood. Remember, if you suspect you may be deficient in vitamin D or experiencing any of these symptoms, it's important to consult with a healthcare professional for personalized evaluation and guidance. Take care, and see you tomorrow in the next video. Thank you for joining us here at the Healthy Pantry. We hope you found the information valuable and inspiring. Remember, your health is a journey, and we are here to guide you every step of the way. Thank you for watching, and we will see you in the next video.